This video demonstrates the proper procedure for flushing vacuum lines. First, attach the high volume evacuation and the saliva ejector to the cleaning system integrated in the ADA cabinets. All three lines should be toggled on. Next, in the control center, hit the button that has the three dots. It's important to clean these lines at the end of each clinical day. The lines should also be run after procedures with blood or sticky debris. Just like the timer buttons, you can hold the vacuum button to increase the amount of vacuuming time. Now you can close the valves and return the high volume evacuation and saliva ejector. Located in the furthest cabinet from the control center, you can find the ICV tank. If you notice that a tank has no cleaning solution or that the levels are not decreasing, then please notify your dental assistant. The vacuum line flushing protocol is now complete.